Hello again and welcome back to BSc Honors Forensic Science Forensic Toxicology course BBS08T2111. I am Dr. Raisha Jasmine Nathan and today I will be taking you through the classification and principles of forensic toxicology. A quick recap of what we did in the last session. We studied about the definition of toxicology, the different types of toxins, exogenous and endogenous, the relationship of toxicology to other sciences such as pharmacology, medicine, agriculture, etc., and the scope of toxicology. What does toxicology entail? In today's class, our objectives of study will be to understand the field of toxicology, the subdivisions of this field, and the basic fundamental principles that are used in forensic toxicology that help in the forensic investigation of different kinds of cases related to suicide, homicide, and accidental deaths. The field of toxicology addresses a number of questions. A toxicology expert is asked to answer certain questions, especially when a legal case is involved. In other fields such as agriculture, toxicology determines the possible health effects as a result of exposure to pesticides, insecticides, or the effect of animal feed additives such as growth factors, the exposure of humans to such chemicals can be risky, and so agriculture requires the knowledge of toxicology to answer such questions. Toxicology is also used in research when dose-response relationships are established and animal studies are performed. In effect, toxicology deals with how a chemical compound affects the health of an individual or a population at large. Now this slide shows the subdivisions of toxicology. Broadly, it can be classified into 12 categories, starting with environmental toxicology, occupational or industrial toxicology, regulatory toxicology, food toxicology, clinical toxicology, descriptive toxicology, analytical toxicology, and then there are other types such as mechanistic toxicology, toxicology that deals with economics, behavior of animals and humans, and biochemistry. As students of forensic science, we would be primarily focusing on forensic toxicology. Talking about forensic toxicology, there are certain fundamental principles on which this science is built. A toxicologist who is involved in solving a medical legal case is expected to answer certain questions. The results that these experts provide help to understand the manner and degree in which these chemicals or drugs or toxic compounds have caused an ill effect on an individual. Experts who specialize in toxicology, especially forensic toxicology, are responsible for producing sufficient evidence from analytical studies that will help support the ongoing case. Five important questions that are asked are: what was the dose of exposure that caused the adverse effect in an individual or a group of people? What was the timing of exposure? What effects were caused by the interaction of these two factors, that is, the timing and dose of exposure? How reliable are the testing or analytical methods that were used on such samples? And were there any other factors that were responsible to affect the human physiology or the testing accuracy of the technique? The first principle used in forensic toxicology is the recognition of the toxic syndrome or the manifestation of the adverse effects for rapid diagnosis and treatment of an illness. Now, toxic chemicals can be grouped together based on how they affect an individual, meaning to say, certain chemicals show similar human health effects or adverse effects, and so such toxic effects or toxic syndromes comprise of a set of clinical fingerprints for a group of toxins. Now, all such toxins that fall in such groups can be treated similarly. This is the first principle based on chemical classes. Now, when it comes to emergency treatment, this principle can be applied so that during the early phases of toxic chemical emergency, when a victim is hospitalized, if the exact cause of that adverse effect is unknown, the identification of such toxic syndromes can be useful in making a decision as to what treatment should be administered to the victim. These toxic syndromes can be identified using the following observations given in the table, but of course they are not limited to just these. These include vital signs, the mental health or mental status of that person when he is hospitalized, the size of his pupils, how much has it dilated or constricted, if there is an irritation of the mucous membrane and if there is any inflammation, the examination of the lungs of the victim, and skin burns, skin irritation, or local injuries. The second principle used in forensic toxicology is that the route of exposure determines the level of toxicity. We've studied in our previous sessions that the same chemical will have different LD50 values depending on the route of exposure. The main three routes of exposure are ingestion, inhalation, and skin exposure. So it is very important to first observe the route of exposure before carrying toxicological tests on the victim. The third principle is that the dose makes the poison. The statement was famously given by the father of toxicology, Paracelsus, and it is very much relevant in the present time as well. Chemicals manifest their adverse effects based on the dose that the person is exposed to. So dose response studies or the knowledge of dose of a chemical compound is important to assess its toxicity. The duration of exposure and the frequency of exposure as well are important factors affecting the dose. When the same chemical is exposed to an individual at high concentrations over a long duration, they are more likely to produce adverse health effects as compared to the same or lower concentration of the chemical in the same individual. Now, in forensic toxicology, there are certain topics of investigation that are performed routinely in any forensic toxicology lab across the globe. In addition to forensic investigations, there are other studies that are also given in this list that may or may not fall under forensic or medical legal category. The first type is adverse drug reactions. If a combination of drugs has caused an adverse reaction. Number two, the determination of blood alcohol concentration, also known as BAC. The third kind is allergens, substances that cause allergies or even produce cancers, called carcinogens. Drug safety, the exposure of metals, natural toxins and poisons that are coming from plants, animals, bacteria, fungi, etc. Neurotoxins, particulate matter, pesticides, herbicides, insecticides, fungicides, recreational drugs or drugs of abuse, the use of solvents and the toxicity caused by them, such as benzene, chloroform, hexane, etc. And toxic gases caused as a result of leakage from industries, accidents, or leakages produced for homicidal reasons, including the leakage of gases at homes that is done by people with suicidal intention and other such cases. Now, these are some of the references that I've taken for this presentation. Hope you find use of them. Thank you so much for joining in today. See you in the next class.